chiropractic and pregnancy. And so we wanted to take kind of a different route again, but still relating directly back to how it is that we can help as chiropractors directly with these patients. Clayton, we see pregnant patients in the office often, all the time. Patients we have
Yes.
now get pregnant, and we continue to see them.
Yeah. I mean, Ben coined this lecture, the backs and bumps lecture, and definitely something. And unfortunately, I'll say that it's something that not a lot of people know that chiropractic can help. So they think sometimes I'll have people say, and I actually have people that'll tell me, I just got pregnant, so I got to cancel my appointments. I'm like, no, 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 no. Right. And there's a lot of education that needs to be given, because obviously when, especially new moms, they're pregnant, they're walking on eggshells, and you're like, okay, well, I got to protect them. And, they lay down on the table, and, so there's a lot of stuff that we're going to talk about tonight that'll shed a little bit of light on chiropractic and pregnancy, and how there should be no other way. Right. And I've had many pregnant moms tell me the second time around after delivering the second baby, saying, I never want to do this again without chiropractic, because they know how it was the first time without, and they know how it is the second time with. And hopefully they find us the first time, which a lot of them do, because they will actually Google what can help pregnancy pain, and chiropractic will appear out of the blue, and they're like, oh, I didn't know. And then they check out online and Dr. Google, and all of a sudden they appear in our office without too much education, just the fact that they now know that chiropractic could help. So they come in and say, I'm pregnant. How can chiropractic help? So how
Mhm.
can chiropractic help, Ben? Let's talk about
Yeah,
that.
so how chiropractic can help? I mean, we've got 50 to 85% of pregnant women will experience back pain.
What?
That's, one in every two, or almost everybody that comes into the office who's a pregnant woman. And 8 to 20%, and that's as high as 20% of women who have had a child will experience pain for longer than 3 years postpartum,
Wow.
right? And so after having one child, a woman may experience pain up until they have that second pregnancy. And then again, we're going through that cycle. Oh, I'm just, this is just how I was after pregnancy. And
Talk
so
about
those
the
numbers, those numbers are way too high. So something has to be done, right? And so that's where chiropractic plays its direct role.
talk about the gift that keeps on giving, eh? Now, I don't have data on this, Ben, but people that have their first pregnancy, and all of a sudden, we're in those numbers in terms of percentage of pregnant women that have pain. I guarantee you that a large percentage of those people had structural and functional issues prior to the pregnancy, and the pregnancy becomes the stress that the body, the dysfunctional pelvis, lower back area can no longer adapt to, and the pain shows up in pregnancy, right?
Absolutely. And I mean, that again is what really pushes women into our office and people into our office, is sort of that straw, right? The
Yeah.
straw that breaks the camel's back, the last thing, is there anything that I can do about this? Because this is unbearable. I know I'm going to be this size, this weight for 9 months. What can I do about this? And so the solution is that your spine is made out of 24 vertebrae, independent vertebrae, and they enable your body to twist, bend, and move. It also helps protect the nervous system, right? That controls and coordinates every cell, organ, and tissue in your body. So neural interferences in the spine, which are commonly known as joint dysfunctions or subluxations in the chiropractic world, occurs when two or more vertebrae become restricted and impede your body's ability to move and communicate with itself. And so during pregnancy, the body goes through such a large change, and there are
Yeah.
new stressors that are being placed onto the spine, whether it be a direct stressor from the actual weight gain, which, by the way, women will gain up to 30 pounds during pregnancy, which is a huge change to go through in 9 months,
Man.
right? And so,
Mark, just to put it, Mark Wahlberg took on a role, and within 6 months had to put on 40 pounds. And in order to do that, he was eating over 9,000 calories a day, right? So imagine the changes that have to take place in order for you to take 30 pounds. I have a pregnant female right now. She's probably 100 pounds soaking wet, and she's taking 30 pounds. So she's now 130. Huge, huge change on the joints and the pelvis and how everything is sitting, your weight bearing, your center of gravity, everything shifts.
Exactly. And if your body's not ready to adapt to this change, if you're not consistently teaching it how to adapt to that change over the course of that transformation,
Yeah.
eventually the body is going to run into a wall where it can
Oh, yeah.
only adapt so much. And when it hits that wall, that's when you'll start getting this interference in the spine. And that's when you'll start feeling the symptoms, the pain that you're experiencing. And so most of the weight that women will gain, obviously, is around the abdomen, adding to a significant frontal load. And the added weight in the front is what will create this dysfunction, which more or less leads to the pain that people are feeling in the hips, low back, and pelvic area. And so
Yeah.
it leads to altered posture and altered biomechanics, like what Dr. Roach was talking about.
Now, something important happens in the third trimester that I want to talk about, and that is a hormone that is being released in order to accommodate, at that point, a baby that's now 4, 5 pounds. And it's a hormone called relaxin, RELAXIN. So what relaxin will do is going to create a laxity in the pelvic ligaments and the surrounding structure so that the pelvis can adapt. So that's all fine and dandy, but now you've got a bag of loose bones, so to speak, that can shift. And that's why sometimes people don't notice back pain until later in the pregnancy when that relaxin hormone starts to occur. Now, I would say that if relaxin gets released, but the pelvis prior to that was in good shape because the person was having chiropractic care, then relaxin can kind of, take hold of the environment without too many issues. But if relaxin comes in and the pelvis is all lax, but it was out of alignment prior, you are going to have problems in your third trimester, later back pain. And then people come in and say, well, it's back labor or it's the baby's position. But all of a sudden, when you have an assessment done by a chiropractor, it might not be that at all. It could be, but a lot of that could be just because of structure and function in lower back.
Absolutely. Yeah. And so ensuring that you're correcting and seeing the chiropractor for the dysfunction early on in pregnancy is definitely worth the is definitely worth going through,
Yeah.
especially when you're experiencing an accumulation of all of these dysfunctions
Yeah.
right before giving birth.
And even before conception, right? Even preparing the pelvis before pregnancy, that would be the ideal, right? Alrighty, Ben.
So yeah, definitely chiropractic and perinatal care. So what are the things that chiropractic can help with? And so obviously when the spine is out of alignment, it's a job of the chiropractor to find the areas that are causing the most dysfunction. And so we'll be looking to the low back, spine, the upper back and neck as well to take off any sort of pressure that may be placed on the nervous system, especially in the low back. If we look at the photo to the left, you can sort of see just how biomechanically the structure of the female begins to change as she's beginning to gain that weight and carry a growing baby there in her stomach.
Yeah.
And so we can see how the lower back, especially the lumbar vertebrae, they begin to get hyperlordotic.
Yeah.
So that's
so hyperlordotic, just so people know, that's too much curve in the lower back. So it'll be like a large C curve in that lower back.
Yeah. And so what that large C curve will do is cause dysfunction. However, with an increased curve, it also places direct pressure onto the posterior elements of the joint. And so which can lead to dysfunctions like arthritis and pain because you're stimulating those nerves and those joints directly, lack of blood flow into the area, inflammation, inflammation just accumulating into the joint. And so if none of that inflammation and none of that blood flow is being circulated through the joint, that's what will lead to that pain locally in that area there.
Yeah, so definitely a shift in everything in terms of what the body is used to. And I just want to point out that plumb line. That plumb line is supposed to go from the middle part of the ear to what's called a medial malleoli, so a little bump on the inside of your ankle. Well, all that shifts during pregnancy. So one of the things that you'll start to see is certain muscles that used to be long are now shortened. specifically, I'll talk about this muscle here called the psoas, right in through here that attaches, you know, from the hip deep into the front part of that lower back. So what happens that because you're leaning forward, that psoas starts to get short and will contribute to that increased curve in the lower back and later on low back pain. Now the problem is that a lot of times these people already had a job that got them sitting for a long period of time. So the psoas is already tight. So now you add a weight on the front and it's just the perfect storm. And people start having low back pain, women that are pregnant, right? So it's just, yeah, most of the injuries or most of the problems you had prior to pregnancy come back to haunt you because there's just more stress on the system.
Exactly. And a really good example of like something that you had that comes back to haunt you is this idea of the forward head posture and the rounding of the upper back. So if you've already had a forward head posture and a structure that's started to change, and your muscles in the back aren't used to holding your erect posture, you're going to start doing that when you're pregnant. And when you begin to
Yeah.
activate these muscles too soon, that's when you start to get dysfunctions up in your thoracic spine. And so a lot of women will present with rib pain. And so that's when the costa vertebral joints, the joint between the ribs in your back and your vertebrae, is not moving properly. And so
Yeah.
you can't take nice deep breaths in. Every time that you lean forward, it's painful. Every time you contract and try to lean back, it's painful. And so correcting those dysfunctions even before pregnancy is a part of the process of making sure that it's an easier and smooth pregnancy for you.
Now, here's an interesting fact is the fact that I kind of clued in on this when you were talking about not being able to take a deep breath. A lot of you might not know, and if this is something that you learned tonight, just put a little thumbs up on your post here. Your psoas, your hip flexor, actually attaches to your diaphragm. So if you are not breathing properly, that psoas contracts even more. So now you've got a psoas, a hip flexor that is contracting because you have more weight in the front of you. So that's contributing to your back pain. And because of that, you're not breathing well, which is contributing to less oxygen, which is now contributing to that psoas being tight even more. And now you've got a positive feedback cycle that is just a nightmare for lower back pain.
Mm-hmm.
So just give us a thumbs up there if that's something that you learned tonight, because that is one of the biggest reasons why a lot of women have back pain when they're pregnant.
Yeah, exactly. Another condition that I'd like to talk about is something called neuralgia paresthetica. And so this is a condition where
Big word, Ben. What does it mean?
big word. So this is when you lose sensation or you receive pain on the outside part of your thigh. And so what happens is when you start to gain this weight and the belly starts to get a lot bigger and the tissues begin to expand, it places a lot of extra pressure on the nerves that exit from the abdomen. And so if there's pressure down in the lower abdomen on this nerve, you can actually choke the nerve. And so you impinge it. And that's when you start to get this pain down the side of your leg. And this will persist even after pregnancy if it's not taken care of, because the scar tissue, even after, remains there. And so it's very important during and even and after pregnancy to have that treated and taken care of, because it can be fairly debilitating for a lot of people.
Yeah. So interesting fact about that nerve, and the nerve is called the lateral femoral cutaneous nerve. And there's a test at the end of this. It can also appear in obese people, people that wear a belt too tight around the waist, including police officers with their holsters, because the nerve is very, very close to the skin and it's sensory only, meaning you will not get weakness from this nerve being entrapped. It's just a sensation along where Ben said, along the lateral thigh. So it's a very, very unique nerve entrapment in terms of the symptoms that it causes and where it causes those symptoms, but very, very common in pregnancy. So again, if you've learned something tonight, just give us a little thumbs up and a little heart. We're discussing, if you just joined us, pregnancy and chiropractic care and some of the conditions that can occur in pregnancy. So what else?
And I mean, I just wanted to do a quick point here that, I've never been pregnant, so I'm not
Really?
going to understand what it's like to go through a pregnancy, right, Clayton? Like, no kidding, right?
Yeah.
But, being that we are chiropractors, we're looking at the spine and the impacts of external and internal stressors on the body. And
Yeah.
so, whatever it is that we can do to alleviate the amount of stress on the nervous system is what our job is to do here,
Yeah, absolutely. I've
to
gone
make
through a lot of
pregnancy.
pregnancies, just not for myself. But I can speak to the conditions and the things that, uh, hurt women when they're pregnant. It's just
Yeah.
it's it's great to be able to provide something for them because it's a 9 months that can be somewhat of a roller coaster ride.
Yeah, and there's no population that, I would rather honestly be more in touch with and more supportive with than the pregnant population and those that have been pregnant, because we both know the amount of stress that the body goes through before, during, and after pregnancy, and what persists on in the lives of women.
Yeah.
Um, so in the event of a misaligned pelvis, the baby's natural environment is restricted during development. And so it means that the baby doesn't have enough room to grow in the pelvis. And so because of these malalignments, Dr. Roach, maybe you'd want to speak to the idea and why it's important to keep the pelvis aligned during
Yes.
that.
Before I do that, I just want to mention, because you had a condition here that we needed to talk about, was carpal tunnel, right? So very
Yes.
common carpal tunnel with pregnancy because of the fluid retention. There's only a certain amount of space in the carpal tunnel for everything that goes through there, including nerve and vasculature. So if you fill that space up with fluid because you're retaining fluid, definitely possible that you will have carpal tunnel like symptoms. The good part with that type of carpal tunnel, typically when the baby's out, carpal tunnel's out, right? But it is an annoying thing to go through when you're pregnant.
Yeah.
Anything else you want to add to that
I
before I
was
go
gonna
into?
say, tarsal tunnel would also be a possibility as
Yes.
well, because you're holding it into the joint. So having numbness into the feet is also really common, and definitely something that has to be explained and can also be treated as well to try and get that inflammation out of the joints to give you some functionality during the day and some more comfort.
And probably not a lot of people here knew about tarsal tunnel. It's like carpal tunnel for the feet, right? So same thing, different nerve. So yes, so why is it important to have the pelvis be in alignment? So I'm going to bring you down the path of a little story here, that if you're from your sacrum, you've got sacral ligaments that extend out to the uterus. So by virtue of where they attach, we call them uterosacral ligaments. All right. So basically, they are like guy wires that attach from the sacrum to the uterus. And as the baby is growing, those ligaments, all right, keep everything somewhat in place. Now, imagine that where those ligaments are attaching to the sacrum, if the sacrum is tilted and doesn't move very well, then the potential or the potentiality of that uterus being torqued is a little higher. So, what happens if the sacrum is not well aligned? Then the uterosacral ligaments take the uterus and torque it. There's a baby in there. So the baby is now forced to move with the uterus and has the potential to become what's called breech or malalign or malposition. Okay. So obviously, any position other than head down with the back to the left is a position that's not ideal for a natural delivery. So the potential for intervention, be it forceps, um, vacuum, C section, goes higher anytime something is not ideal. So the the seriousness of that sacrum being out of alignment potentially is high, right? Because it's what can make or break the hopes of a couple to have a natural birth. So it's ideal to see a female prior to her becoming pregnant to make that pelvic area work better and move better and be aligned. Although sometimes we will see somebody come in that Googled something online, breech presentation, how to help, and chiropractic will come up. And here they come at the 11th hour. When are you due? Next week. And the baby is side lying, head up, brow facing. And now we've got to work with a technique that we call Webster in utero constraint technique to try to shift that pelvis and that round ligament as well, to try to shift that baby by taking the torque out of the uterus by leveraging the pelvis. So a lot of females don't know that, and a lot of couples don't know that, and unfortunately have a natural birth go into intervention after an intervention, and then whatever you had written on your birth statement or your birth plan gets thrown out because things didn't go the way you wanted them to go. So
Right.
that's the story behind the need for the pelvis to be in alignment.
And see, that is awesome information because there are a lot of people that don't know about that. And so our job as the chiropractors to take as much stress off of mom and baby as we can. And so
Yeah.
by the time that we get to birth, there's very little stress on the child's nervous system. We've taken all of that, those uterosacral ligament stress off of the baby there, off the uterus. And at the same time, when the child is born, we're limiting the amount of stress that they have to go through to actually have that birth. And
Yeah.
so limiting the use of forceps, limiting a long and stressful labor,
Yeah.
right?
And let
Limiting
me clarify. Yeah, exactly. And let me clarify something. Like, we do not turn the baby. What we are doing is realigning the pelvic structure and allowing the tissues, the ligaments in the uterus to take on a different form because of the better structure. Now, that is much different than the maneuver. I forget the name, what they call it, but the maneuver that obstetrician use externally to move the baby. So they will physically, from the external, try to shift the baby, which can sometimes actually called fetal distress, right? So now the baby's heart rate starts to go up, and that alone can create a premature labor and start things going. So we got to be careful in how we intervene, and we want to remove stress from the baby. We don't want to add stress to the baby. So what we use in order to create that, we got to make sure that it's not adding any stress to the environment.
Of course, yeah. And so for those of you who are learning something new right now, give us a thumbs up. If you didn't know already that chiropractors remove stress from mom and baby and everyone else, this is what we do, trying to remove the stress from day one all the way until the end.
Now, and some of you might be sitting there and saying, "Well, I'm not pregnant. This doesn't apply to me." By sharing this video, I guarantee you there's going to be one or two people that see this eventually by sharing multiple times, that they're going to see this and say, "Man, I didn't know this." And they might be having a pregnancy from hell, right? And nothing's going right. And, there's nothing worse than having a pregnancy from hell and then having to nurture a baby. Like, the day starts the next day. Like, there's no time off after delivering a baby, right? And you got to nurse, and life starts, and you're in pain. You can't get comfortable when you're nursing because you got back pain. You got to plant that pregnancy and make sure that everything is working properly so that you're ready for the marathon, which is raising a child after that, with no break in between.
Exactly. And so once you go to your chiropractor and you have everything worked on and you have the pelvis aligned and then you have a beautiful birth, then what happens after that? Chiropractic and postpartum care.
Yeah.
And so giving birth is a trauma in itself, okay? And even after having your adjustments done and getting everything the way it is, the birthing process is still very strenuous and stressful on the body. And so you have to have the chiropractor there right away to take care of any sort of neural interferences that may have happened during birth.
Yeah. So one of the things that we mentioned was the relaxin hormone, right? Well, the relaxin hormone is going to go away after pregnancy. Well, where's the pelvis going to return? It's going to return to probably the dysfunctional state that it was in prior to the pregnancy and during pregnancy, right? So then people end up with postpartum pain, right? So we got to make sure that as relaxed and because we don't know when the patients come in. Sometimes they come in after giving birth and they have pain. That's why they come in. So we don't have the luxury of preparing things and having them go through a great pregnancy. So now we have to work and reverse engineer and get the pelvis so that it's right, so that potentially down the road there is another pregnancy that goes a lot better, right?
Hmm. Yeah, and definitely. And so there's lots of different things that a chiropractor can help with. One of the main points that I wrote down here is mobilization of the C-section scar. And so ensuring that the scar tissue doesn't build up and impact the nerves nearby. I know a lot of women who have had this, and I've started working with them to try and release that tissue and get that scar tissue to break down so they're not experiencing as much pain from that. And a lot of women experience pain in that area years after they've had it done. A second point is intercostal neuralgia. And so again, talking about the ribs in the back, this may persist even after pregnancy, and people that aren't even pregnant have this condition just from sitting at a desk at work all day. And so
Yeah.
that's when the nerves are irritated around the ribs, and they can even wrap around the rib cage to the front.
Yeah.
And so having that treated by the chiropractor during pregnancy, after pregnancy, big point.
And that is definitely true with babies that were side lying most of the pregnancy, like during the third trimester, because the mom is feeling like she's being kicked in the ribs like every single day, either by an elbow or the feet. When the baby side lying is definitely worse than that, the worst position. Neuralgia parasitic, I remember that was the lateral femoral cutaneous nerve. I knew it was going to come back to haunt you guys. You better remember. And that's the superficial nerve on the side of the hip, right? So now the baby's gone and you still have that burning sensation, numbness on the side of the thigh. What do you do for that, right? So there's stuff that we can do as chiropractors to release that nerve. Specifically in the clinic, we'll do a technique called active release technique to get that nerve freed up and healthy again. So that way you don't feel you've got like a blowtorch next to your hip, right? Go ahead, Ben.
Yeah, and I was just going to say, definitely we would be, we would definitely be uh, doing women a favor to talk to them about pelvic floor exercises and the importance of strengthening the pelvic floor after giving birth. Like oftentimes women who have a poor pregnant floor or a poor pelvic floor strength will experience, loss of bladder control, and so they'll lose that control there because they don't have the strength to hold the urine into the bladder. And
Yeah.
so women that experience this post-pregnancy have a weak pelvic floor, and so a chiropractor can definitely suggest where to go to get the treatment, as well as provide the treatment should they choose to do so.
Yeah, and if anybody here has ever had a baby before, afterwards, if you've got lack of bladder control, every sneeze is an adventure, right? So you definitely know the importance of pelvic floor exercises and getting that pelvis back into form. And what else? I always say down the road, obviously, if you're going to be nursing, which I highly suggest in terms of the benefits of that, you know, you're going to be nursing 4, 5, 6, 7 times a day, sitting with your head down, looking at the baby to make sure that it's latching. One of the best ways to do that, and I encourage all my female patients to do this, and it happened to my wife too, is to be able to lay on your side to breastfeed as much as you can. Whether you're in bed, on the couch, it's a much more comfortable position for you and the baby. Once you get the hang of it and have the baby latch, you are going to get a burning pain across your shoulder blades that even your chiropractor is going to bang his head against the wall and say, how do we get that to stop? It keeps coming back. And the reason it keeps coming back is because you're creating a repetitive strain injury every time you breastfeed by having your neck down, looking at the baby breastfeeding.
Mm. Yeah, that's a great point, and that's a great segue as well into why we would also practice diaphragmatic breathing. So that's breathing through your stomach, breathing through your through your diaphragm rather than breathing through your chest, and activating and further activating the muscles that are already really tight, like your traps, for instance, and a lot of your deep neck flexors. And
Yeah.
so learning how to take those nice deep breaths with the diaphragm rather than through the chest here, hugely important, especially when you're getting into trouble with the upper back and the ribs.
Oh yeah. All right.
So there are guidelines.
Guidelines.
In 2019, there were guidelines released for the physical activity during pregnancy. And so believe it or not, and back in the day, it wasn't recommended, and we didn't know if it was okay for women to undergo exercise while pregnant. And so what they released in 2019 were these guidelines to help guide women through the safety of exercising and not having to look back and wonder, oh, maybe I shouldn't have done this or I shouldn't do that looking forward. So it gives us a little more certainty as to, can you exercise? And so the guidelines have really shifted in a philosophy from behaviors to improve quality of life to prescription for physical activity to reduce complications and optimize health. Okay, I think that's great. I think the philosophy is cool, but I still believe that exercise plays a paramount role in improving quality of life. And so I still think that that's a big, it should be up there. They shouldn't say, and this is what I read where it made a shift from one thing to another, but to have that quality of life component is hugely important because it optimizes your health in other ways that you never even considered to be even there. When you think that because for 9 months you're going to be holding this child that you can't do anything, and now you can exercise, especially when you're used to doing it before pregnancy, that's like such a huge morale boost.
Yeah. Just for mental health too, right? Like
Yeah.
you're at home, and if you're not working, like to be able to go out there and exercise just for your mental health is huge, right?
Yeah. And so I listed the recommendations here on the PowerPoint, and just to read it off, and they recommend a minimum of 150 minutes of moderate intensity exercise per week. And so if you're familiar with moderate intensity exercise, it's a brisk walk. You should be able to breathe, definitely breathe and talk through a conversation while you're doing your exercises. You're not going for a long
CrossFit.
Yeah, you're not doing CrossFit or anything like that. That's going to overload and stress your nervous system. You want to keep it at an appropriate level. They also recommend that if you were exercising prior to your pregnancy, that you can exercise at that level even while pregnant. Now, if you're just jumping into exercise as you're pregnant, you should definitely start at a baseline level, at a very low level, because the body's not used to that extreme stress.
Yeah.
So physical activity should be accumulated over a minimum of 3 days, is what they say, a minimum of 3 days. So if you get 3 days in of walking, each walk being whatever 50 minutes in length, that's great, right? Yeah, you should incorporate a variety of different exercises. And so aerobic exercises are like going for a brisk walk or a little bit of a jog. Resistance exercise, using bands or lighter weights. Trying activities like yoga and gentle stretching is also beneficial. And they don't recommend doing a lot of heavy core exercises because of the stretching of the abdomen. You actually get a giant stretch in the middle. It's called diastasis recti. And so the abdomen becomes very weak. So you're not necessarily doing very much core strengthening at that point.
Yeah.
The other point is pelvic floor training. So we talked about pelvic floor exercises, and so namely the Kegels. And you can all look up Kegels, and I'm sure women who've been through pregnancy have heard Kegels and have been doing them. And avoid your physical activity in excessive heat. Remember that the body is not in the greatest position to adapt to large changes.
Yeah.
And also you're carrying someone new, and that stress of excessive heat or excessive cold is not very great on the body. No physical contacts or any sort of danger of diving. And then I've also put in no scuba diving. So for the scuba divers, and I know it's a big topic in the scuba diving community, that some women went diving, they had no complications, but then other women went scuba diving and they did have complications. And what they attributed to is the increases in pressure. And so the changes in pressure puts an extra stress on the fetus as it begins to develop and grow. And so you don't want to do anything that will really change the internal environment to that degree.
So ideally, then no hot yoga.
Sorry?
No hot yoga, right?
Yeah, no hot yoga.
According to this, right?
Yeah, yeah. Anything that's going to stress, anything that's going to overload or stress the nervous system, because the body is not adaptable and it can't change its environment quickly. It seems like anything that would change the environment or make it hard to adapt is avoided.
Yeah. Yeah. Very good, Ben. I didn't know that there was Canadian guidelines for physical activity throughout pregnancy. I actually didn't know that.
Yeah.
I
And
thought
so
it was just,
there was a
yeah.
huge study done, and it was great. And so again, supplement of the month. This is our last week with the promotion for Serenity PM. And so it helps you keep a healthy sleep schedule. It boosts all those great hormones, the ones that you're missing when the body is when it has restrictions or any subluxations. You're missing all these really happy hormones like serotonin, GABA, melatonin. And so this Serenity PM is a really good booster for those and really helps to bring those levels back up to a level where they should be.
Had a patient tonight, bought a bottle, third bottle. She says it's changed her sleeping. She tried magnesium and everything else. She gets a sound sleep with Serenity PM. We are done tonight. So I think, you know what? This was great information. Like I said, it may not apply to you right now, but it may apply to somebody that's watching that could potentially watch this. Nephew, nieces who are planning on getting pregnant. You don't have to be pregnant now. Ideally, we see them before and prepare their pelvis, which you now know is important and why, to increase your chance of having a natural pregnancy without any of the complications potentially from like C-sections and vacuum deliveries and forceps, and hopefully reducing the risk of that by preparing the pelvis, make sure everything is good.
And also reducing time in labor.
Yeah, actually,
so that's like one of the big points. And like there was a study published saying that those who were treated by a chiropractor having the pelvis aligned had shorter labor times than women who did not. And now there was a certain percentage that they gave. It was pretty high, and I thought it was statistically significant.
And I haven't met a female who wanted their labor time to be more than the first time. So and again, just to touch base on the physical activity as well, like you got to realize that labor is like a marathon. Now, how many of you would go out and set out to run a marathon without training for it? So, physical activity is huge to prepare yourself, so you don't fatigue. Everybody fatigues during labor, but you're actually able to pierce through it and be able to finish the job, so to speak, and give it your all, so that there's no looking back and you leave it all there and be able to, pull through and have a great birth.
Exactly. That's a beautiful, beautiful point. And I mean, the same thing can be said for a lot of different surgeries, right? Post-op, right?
Yeah.
So we do a lot of pre-op exercise, pre-op treatment, better prepares you for that surgery. And then your post-operative rehab afterwards it gets so much better because you were preparing the body prior to. So the same thing goes and the same concepts apply to pregnancy.
So as you all know, guys, the reason we did Hump Day Conversation was to help people outside our four walls. Doesn't matter if they're in another province. And so as much as we can help those people, you can help people that we don't know by sharing this episode. So please right now, just take a second and just hit the share button right below. You can do it right now and share this episode to your social networks. And, maybe in the description, write down, check these guys out on YouTube and, help promote the word, so to speak, about chiropractic and how it may help people in another province, somewhere in Canada, across the world. It doesn't really matter. That's the beauty of these Hump Day conversations, that we're not selfish enough to think that everybody's going to come in and see us. But if they're somewhere else and they're going to see someone else and they have the ability to get off their Tylenols and Advils or have a great birth and, be helped with Parkinson's and what other topics we've talked about, then that Ben and I will feel that, we've accomplished our goal with these hump day conversations. Anything you want to add, Ben, before we head off?
Don't forget the importance of nutrition. Okay. Don't forget about the importance of nutrition, drinking enough water, spending enough time outside, ensuring that you're getting enough sun, and the importance of spending time with your family and your friends. And so going into this long weekend, where everything is seemingly looking great and things are opening up and the future is looking bright, don't forget to spend that time with your family and friends and get that healthy benefit that you need as we head into a new month of August and a long weekend.
Beautiful. So with that, make sure to share the video. Make sure to hit us up on YouTube. If you're not a member of our YouTube channel, we post all these episodes. So a little easier to find our past episodes versus trying to scroll on the Facebook feed. As you know, you see it once and you never see it again and you got to look for it. A lot easier on our YouTube channel. And we could use a few more subscribers on our YouTube channel as well. So if you're watching this on YouTube, make sure you hit the subscribe button. So with that, I wish you a great rest of your week. It is Wednesday. It's Hump Day. Conversation with Dr. Ben Boudreau and I, Clayton Roach from Bedford, Nova Scotia in Canada. And looking forward to seeing you guys next week on our 35th episode. And we will talk soon. Have a great rest of your week. Myself, Clayton, see you later. And Ben.
Ciao for now.
Take care. Bye-bye.
What's up, guys?
Listen, if you like this episode, you'll probably like the other ones. Chances are pretty good, so here's what you need to do. You need to like us and follow us on Facebook. Following means you get notified when these two guys
are live.
Next, family, friends. You need to share these episodes because you never know. You might help them because they need this information as well.
And guys, if you ever miss an episode, make sure you subscribe to us on YouTube. That way you can watch the episode over and over and over again.
Guys, we love you and appreciate you.
Take care.